It's time for another Medicare Supplement rate update. This is important info for those who are existing Medicare Supplement policy holders, as well as for those who are turning 65 and or considering getting a Medicare Supplement policy. In this video, I'll review rate increases and even one decrease for the following companies: AARP/United Healthcare, Aetna and its subsidiaries, Aflac, Allstate, some of the blues, Cigna, Humana, and Mutual Omaha and its subsidiaries. One thing that you will clearly see is that over the last few years, the rate increases on open blocks of business have continued to rise each year. I will also show you the average increases from 2021 to 2025 from the top Medicare supplement companies for Plans G and Plan N. This will show you which companies on average either increase their rates the most or keep them steady. Going with a company that has had a history of keeping them steady can be the right thing to do. Hi, I'm Chris Sprang, the Medicare analyst. I'm a licensed agent in 16 states and I am based out of Charlottesville, Virginia. Maximizing your Medicare should be important to you, and my goal is to help people like you make a wise and confident decision about all of your Medicare choices so that you can protect your income, your assets, your savings, and your health. Before I get started, if today is your birthday, then a very happy birthday to you. Joy Page said, "If every year is a marble, how many marbles do you have left? How many sunrises? How many good opportunities to rise to the full stature of your being?" Okay, average rate increases for open blocks of business. Take a look at this chart. This chart shows you the average rate increases for open blocks of business on plans F, G, and N. It is very clear that 2024 and 2025 have had higher than normal rate increases. For 2025, the Plan F is up 12.4%, the Plan G is up 12.8%, and the Plan N is up 12.1%. This is after nearly 10% increases in 2024. Remember, these are averages. These increases will vary depending on the company you are with, the location in which you live, the amount of medical services your fellow policyholders have utilized, and perhaps your age. Now take a look at this chart. This is showing you the percentage of rate increases based upon the percentage amount increase. Look at the row where the increases were in the 10 to 19.9% range. Notice how in 2024 it jumped up to 34%, and then in 2025 it's up 50% of the rate increases are in this range. Then for the rate increases over 20%, you will see in 2022 to 2024 it was only 1%. Then bam, 2025 it's 10%. Okay, let's look at rate increases by company for in-force blocks of business. In-force means people that have existing policyholders, not new business. These rate increases are not necessarily across the board on all the different plans the insurance company has with the state. Take these as either an average of all their plans or what was reported for a particular plan like a Plan F or a Plan G. AARP, United Healthcare, is up 12.1% in various states and plans. Arizona, depending on the area, was up 12.7 to 21.1%. Tennessee, depending on the area, was up 6.9 to 14.9%. And then up 12.6% in Illinois, North Dakota, and Ohio. Aetna is up 14.3% in Kentucky, up 15% in Maryland and Pennsylvania. Their subsidiary American Continental is up 19% in South Dakota. Their other subsidiary Continental Life is up 22% in Michigan. Aflac up 18.8% in various states and plans. Allstate up 17.6% in various states and plans. In regard to Aflac and Allstate, both are new to Medicare supplements in the past 3 years, and both have had low introductory rates. Time is showing that they are now catching up. How about some of the blues? Blue Cross Blue Shield of Louisiana is up 9.2%. Blue Cross Blue Shield of Michigan is up 6.5%. Blue Cross Blue Shield of Arizona is up 14.5%. Blue Cross Blue Shield of North Carolina is up 4.7%. Care First Blue Choice is up 8% in Virginia. Care First Blue Cross Blue Shield is up 6.7% in Maryland. Primera Blue Cross Blue Shield is up 9.8% in Washington. Primera Blue Cross Blue Shield is up, you ready? 55.6% in Alaska. Regents Blue Cross Blue Shield is up, it's actually down 2.6% in Idaho. Regents Blue Shield is up 10.9% in Washington. Cigna is up 9.9% in Idaho, up 7.3% in Texas, and up 7.5% in Florida. Humana is up 8.3% in various states and plans, and then their Humana Achieve Medicare supplements are up 10.7% in Georgia. Mutual Omaha is up 13.7% in West Virginia. Omaha Insurance Company is up 12.2% in Idaho, North Carolina, and Utah. And then their Omaha Supplemental Insurance Company is up 16% in Ohio. And United of Omaha is up 6.7% in Delaware. And just for fun, here are some recent updates on 3 of my Mutual Omaha clients here in Virginia. You see they range from 12 to 15.57%. Okay, let's take a look at average Plan G and Plan N increases over time. On this chart, you will see the average Plan G rate increase by company. You should clearly see that for 2025, Aetna and Mutual Omaha have had the largest increases, with Aetna being around 16% and Omaha being around 21%. If you saw my previous rate updates, then you may recall that in 2024, both Mutual Omaha and United Healthcare had the highest increases. You should also see that once again, both Cigna and Humana have remained the most steady. I don't know about you, but I like steady. I'd even rather start at a slightly higher rate, but not have the rate go up as fast as one of the ones that had a lower start rate. Then for the Plan N, you see again that it's Aetna and Omaha going way up, over 16% for both. United Healthcare also going up a good bit at 11% for 2025. And again, you see Cigna and Humana being pretty steady. It will be interesting to see what they do with rates in the future. Telos Actuarial states, quote, each group is showing larger rate increases in 2025 than in previous years. The data suggests that Aetna and Mutual Omaha have been pursuing significantly larger rate increases in 2025. Alternatively, Cigna and Humana rate increases are more aligned with what they have taken historically. It will be interesting to see if some of the higher historical averages will help prevent the need for double-digit increases or simply delay them. So what can you do? If you are new to Medicare and or considering a Medicare supplement for the first time, and you are relatively healthy and don't frequent medical services all that often, then at least consider a Plan N over a Plan G. As we have seen, the Plan N goes up at a slower rate, so over time, your savings will get greater and greater. If you have a Medicare supplement and the rate is getting out of hand and you are relatively healthy, then consider applying for a new Medicare supplement at a lower rate. Perhaps you have a Plan F. Now then consider going to a new Plan G or a Plan N. In most states, you do have to go through medical underwriting to be approved. A number of states have a birthday rule where you can get a new supplement guaranteed around the time of your birthday. Of course, the rate has to be less enough to make it worth your while. And more states are passing birthday rules. Virginia being one of the most recent ones, you can see my recent video about this. I think you will see more states doing this. The bad news about birthday rule states is that everyone pays more in the end. You may be saying, Chris, I just can't afford the premium anymore. I understand. If that is the case and you have adult children, then ask them if they can help with covering some of the premium costs. After all, you forked out a lot of money for them at one time. They likely owe it to you. Now, if you're really healthy, maintain your health, like to eat really well, exercise, get plenty of sleep, etc., then you could consider the high deductible Plan G. These typically go up very slow. I've done videos on the high deductible G. It is Medicare's best kept secret and the best alternative to a Medicare Advantage plan. You can check out my other videos to learn more. And if you are in New York, well, then almost everyone should just get a high deductible G in the first place because the savings are so huge. Last thing you can do, other than bite the bullet on the high and increasing premiums, is to very carefully consider a Medicare Advantage plan. But be careful. Sure, you can get a Medicare Advantage plan for $0 per month, and that might be $200 to $400 less than your Medicare supplement. But what happens if you start going for lots of treatment or hospital stays? Your co-payments each month could easily exceed what you are paying in premiums. If you do decide to switch to a Medicare Advantage plan and you've never had one before, then you have a 12-month trial right where you can get your supplement back guaranteed. And guess what? You might, and I mean you might, end up with a lower rate than you had before. All right, that's it for today. Sorry for some of the bad news. I do hope that you have found this helpful. If you have any questions about what I've just gone over and when you are ready for my help in maximizing your health care and retirement insurance coverage and making a wise choice when it comes to all of your Medicare insurance options, and you live in one of the states that I'm licensed in, which you can see right here, then please feel free to reach out to me either by phone or through one of my contact forms on my website. We will have an open and honest conversation about your healthcare needs and philosophies and budget. I will do my best to answer any of your concerns or questions that you may have. Once we determine what is best for your unique needs and budget, I will then enroll you in the plan or the plans of your choice, and of course, be available down the road for your support. To stay up to date and to gain more insight on maximizing your Medicare insurance, then please go ahead and subscribe. And who do you know who may benefit from this info? Please share it with them. I'm Chris Prang, the Medicare analyst. Make it a great day.